Shawn mentioned the transversus abdominis is going to be the deepest layer, and that's actually going to go all the way across the abdomen, and again attached to that area in the back called the thoracolumbar fascia. Again, that's going to help create rigidity in the cage, in the entire thoracic cage, or abdominal cage. You are not going to be able to train these muscles really individually. Neurologically, if we look at how these muscles are innervated, it's very difficult to split out and just activate one particular muscle. There's a few different training camps out there that think that you might be able to just train the transversus abdominis, external or internal oblique, but if you actually do EMG studies where you insert needles into the muscles, it's extremely difficult because they all share a common innervation. However, certain parts of the muscle or certain areas of the muscle neurologically can get turned off, and that's a lot of times where we see issues with athletes. If you're facilitating one area of the muscle constantly, defacilitating another area of the muscle, that's where we create some of these imbalances that we're talking about. So again, like Dr. Allen was talking about, when we're looking at our clients, what we want to think about is we want a relative midline of the body. If we start to see a shift or a cave on one particular side, that's going to point us to some areas of weakness where they could potentially have a problem. The other important thing that we don't always think about with the core is it's extremely important in upright stance, moving, and ambulation type activities where we're walking and running and doing things like that. Generally speaking, when we're moving and we're forward progressing, we're bringing one leg forward, it's the external oblique and the abdominals on that side that actually be helping to draw the pelvis forward rather than using some muscles deep inside the hip complex, which unfortunately are overworked a lot of times with abdominal progressions.
Dr. Wardup's brought up a good point here in that the obliques are critical for gait, ambulation, push-off, but also for swing phase during walking and running and athletic endeavors as well. So when there's an asymmetry here, you can see in some athletes a collapse of the hip or pelvis on one side into the abdominal cylinder, as we will call it throughout these video progressions. The abdominal cylinder, or the core cylinder, it needs to be approached from that perspective, in that this abdominal wall, if you were to take a cross-section through here and look down, you need to think of muscles all the way around, like numbers on a clock. And if each number on the clock has some degree of appropriate tone, you have a cylinder in which the torso can rest down onto it in a symmetrical fashion. But if you can imagine taking out 2 o'clock and 3 o'clock, or maybe 2, 3, and 4 o'clock, that part of the cylinder can't provide adequate postural tone. Perhaps even more so concentric, eccentric, or isometric contraction. And now you get this shift off of midline. One of the easiest ways to look at these midline shifts is to look at the center point of the sternum, center point here, and abdominal wall. And some clients you will see, or athletes you will see, a slight curve to one side. And that's indicative usually of some degree of imbalance in the abdominal wall. And that can play out when you start to train the core. We'll talk about open and closed chain core exercises here, and some of the myths and fallacies, but also some of the truths. And the core can really only be engaged effectively for an athlete when the foot is on the ground. So you can't separate abdominal training in a large part from appropriate foot contact, and that will bring in one of our future DVDs regarding foot and ankle stability and positioning and strength and training and whatnot.
One of the things we want to think about the first time when we're evaluating a patient and we're thinking about core strength is there are certain anatomical limitations which may be present in that patient. The presence of a scoliosis or a curvature of the spine is obviously going to change how those core muscles are going to work. But there's other things that might. Has the person ever had any kind of an injury? Have they had any sort of abdominal surgery? If it's a lady, have they had a C-section or anything like that? Once we start to compromise the ligamentous system, which are how some of these muscles are going to attach in this area, we're going to disrupt the portion of that cylinder and actually start to cause some degree of asymmetries in function. When we ever have asymmetry in function, usually pathology or a problem or an injury is something which is going to follow later.
That's a really important point, that from a coach, a physician, a therapist, what have you, a trainer, and even as the athlete, you need to pay attention to violations to the abdominal core and wall. We constantly see clients who have had gallbladder surgeries or appendix surgeries through just portals, through scope portals. But some people will come in who have been around a little longer, will have the more gross scars on the abdominal wall that are larger. That is a violation of the actual core cylinder. And it's quite interesting that gallbladder, appendix, and hernias are almost always on the same side. But this is going to bring in some of our discussions on this DVD.